Continuous positive airway pressure machines, also known as CPAPs, are crucial for the health of many people who suffer with sleep apnea, but access to them in the UK can prove challenging. Sefam Medical are working to meet the demand with their technology-driven CPAP products and software, allowing patients access to life-enhancing therapy whilst also reducing the burden on healthcare professionals.
Unlike some medical conditions, this one strikes at night. Sleep apnea is when the airway narrows or closes during sleep, stopping breathing up to hundreds of times per night. Left untreated, it can lead to other serious health problems like stroke and heart disease. But it is treatable with a continuous positive airway pressure machine, or CPAP, which pumps air into the airway, keeping it open throughout the night.
We see people that stop breathing 70 times an hour, and we can drop them down to 6 times an hour on CPAP. That difference allows the patient to benefit from getting good, deep recuperative sleep and good dreaming sleep, and hence they are able to wake up in the morning and become a functional human being.
But since the coronavirus pandemic, these crucial devices have been in short supply, adding pressure to NHS respiratory staff already stretched to the limit.
I wouldn't say there was a panic, but there was definitely an urgency.
Mike McEwen is the managing director of Sefam Medical, a longtime French manufacturer of CPAPs, now supplying thousands to the UK.
What became very clear very quickly was that there was high-level interest in ensuring that a source of devices was found. We started really delivering maybe in the December of 2021 in the quantities that would allow the NHS to start allocating product to those hospitals which had the biggest problems.
Ian Wheatley's clinic was one of the first to begin using Sefam's CPAP machine called the S-Box. It's designed to streamline treatment with integrated digital monitoring and a secure cloud system that gathers and stores patient data without an in-person visit.
Now with the cloud-based system, the patient doesn't have to be sat in front of you. You could be on a video or a telephone or wherever, but you can review the data online, you can titrate therapy if you need to, you can discuss that with the patient, you can set a time for when you want to review them again.
And Sefam's smartphone app displays important feedback and diagnostics, allowing patients to better manage their own care.
We are then able to help the patient almost in real time, and we can increasingly do that remotely via video conference or by teleconference, say dragging the patient into a hospital outpatients department. If we can do things remotely, it's better for us. It's also far better for the patient.
It isn't just about effectively treating sleep apnea, it's also important to diagnose it. In fact, according to one estimate, up to 90% of potential patients don't even know they have it. That's why Sefam also distributes the Sunrise device, which tracks sleep movements to diagnose sleep apnea in just one night, saving time and resources.
The idea is that if you can take away your staff from doing diagnostic studies and do those studies more efficiently, then you've got more staff time available to treat patients, whether they're new patients or supporting your ongoing patients.
Sleep apnea affects nearly 5% of the population, and as more patients are diagnosed, clinicians will be looking for ways to manage with limited resources.
This problem is not going away, it is actually getting worse. So it's bringing in the new patients, managing the old patients, within a resource-limited service.
A health service, Sefam Medical, is serving one CPAP at a time.
The team have been in and provided us with training to support us in the areas that we need to learn, and they've been very responsive. Customer service-wise has been spot on.
I think stepping in and helping the system keep running at a time when it's very stressed, I think to myself, actually, that's a pretty good place to be.